listening to Smooth 98.1 Love Music, Love Life. You are welcome to the Smooth Health on the Drive, brought to you by Evercare Hospital. My name is Judith TV.
I'm Katie Baker.
There.
Yes, trying to set up for the show. Of course, it's Smooth Health. Welcome to the show. If you just joined us, you are just in time. We're going to be giving out vouchers on the show today. So if you are joining for the first time, now is the best time to be a part of the conversation. We have a very special guest in the studio. Judith, you want to do us the honors?
Yes, of course. We have with us Dr. Yamsani. Dr. Yasni. Okay.
We have Dr. Srinivas Yamsani.
Yamsani, you said it. I'm like,
yes.
I'm sorry, sir. It's Dr. Yamsani. He's here with us in the studio. We're discussing the role of medicine, of emergency medicine, and how it plays in patient care. All right. He's an emergency physician with over 20 years of experience in emergency medicine across many countries, including Oman, the UK, Ireland, and India. He has also been involved in teaching emergency medicine for almost 14 years and is currently the HOD and Director of Emergency at Evercare Hospital, Lekki, Lagos. He's a member of the Royal College of Emergency Medicine of London, UK, and he served in NHS of UK and HSE of Ireland medical systems for 3 years. He has a passion for emergency medicine, which involves stabilizing acutely ill patients and bringing them out from resuscitation red zone to completely stable green zone. He's literally a lifesaver. Additionally, in year 2005, he became an instructor in basic life support and advanced cardiac life support. That's BLS and ACLS. He's recognized with American Heart Association and Resuscitation Council of UK, with further training as an ATLS instructor in 2015 in close collaboration with America Trauma Life Support. Doctor, you're welcome to the show.
Thank you, and I'm happy to participate with you.
Yes.
And it's a very pleasure moment for me to have a discussion with you, and thanks for giving me a chance to communicate with the whole population of Nigeria and Lagos State.
Absolutely.
All right.
Of course, you're welcome. Remember, you can join the conversation as always on 0809-444-0981. Our doctor today is Dr. Yamsani, and he's going to be talking to us about emergency medicine.
All right, doctor, so we've got a ton of questions, and I'm sure that our listeners out there have got tons of questions to share with you. So, like Judith mentioned, we're talking about the role of emergency medicine, right? The role emergency medicine plays in patient care. So I'd like to ask you this. First things first, though. What is considered emergency medicine, and how is the role of an emergency medicine physician, right, different from a general physician?
Yes, I can answer you this question, and it's very important as well to understand what is emergency medicine as a basic itself. So the emergency medicine medicine deals with all specialties, just like a general physician also normally sees many specialty patients. But whereas the emergency medicine differs from the general medicine is that the emergency physician deals with life-saving interventions and life-saving treatments.
Okay.
And also the emergency medicine physicians, they deal with even surgical specialties, whereas a general physician may not deal with the surgical specialty treatments. And so that's where the emergency medicine is one place where every specialty has been dealt with.
Okay, so every specialty deals under emergency
medicine, including life-saving things.
All right, interesting.
But doctor, what type of situations are considered an emergency, right? And how can they be responded to? Do you have any tips for non-medical listeners today on the show?
Well, yes. This is emergencies for a non-medical listener to understand. I can say in a layman terms, like we might have heard every day in day out that kind of heart attack for patients, and patients with a stroke, brain stroke, and patients with patients who have suffered in a road traffic accidents.
Okay.
So these are common things which we normally see for a layman listeners to understand. But there are many other also conditions which they may not understand.
Can you break it down for us?
Yes.
So you say
there are many list of things.
Road accidents, right?
Yes.
But what else are the irregular things that we would see that's not that would be that could be directed to an emergency room for emergency medicine?
Apart from road traffic accidents?
Yes.
Yeah, as I said, heart attack patients.
Okay.
Patients with low blood pressures.
Okay.
And patient with brain stroke.
Okay.
Patient with high blood pressures. And patient with never know what is the cause of some pain abdomen. So there are many surgical and medical. There are many lists too out, but these are the common conditions which I am telling. And any infections, someone with consumed some poison.
Okay.
So all this comes under emergency medicine, and the treatment can be just started within a few minutes.
All right. If you're out there, by the way, and you just joined us, Smooth Health is what you're listening to. Today we're talking about the role of the role emergency medicine plays in patient care. And just like we mentioned at the start of our show, Dr. Srinivas Yamsani is our very special guest. Bit of a mouthful.
No problem.
Yes, and so you can also send in your questions if you have questions concerning emergency medicine, and you want to get full details about that. 0809-444-091 is where you can send your messages to. So, Doctor, we'd also like to know this. We would like to know the steps that you take in an emergency situation. Also, we'd like for you to walk us through, the time frame to get like medical intervention, amongst other things. So we'd like to know how the process works.
Well, emergency situations, the time frames are certain medical conditions are there. It is called as golden hours. In golden hours, that means if the patient is not dealt within that few hours of the condition, the patient might lose the activity of that particular organ.
Okay.
So, for example, as I said, a patient having a brain stroke. Okay. In the brain stroke, patient maybe some patients will not have one side hand working or leg working,
okay,
or he has some facial deviation and he cannot speak. That means some part of the brain blood circulation is got stopped.
Okay.
So the golden hour, for example, for that patient is within 3 to 4 hours. We need to initiate the treatment very urgent.
Okay.
And where we can revert the situation. And that is for an example I said. So once we give the injection within that thrombolytic, it is called, if we give the injection within that time frame,
yes,
the patient can get a better outcome and lead a very good quality of life for the future for the rest of his life. Yeah,
that's wonderful.
Yeah.
So what type of accident and trauma emergency care services is Evercare Hospital equipped to handle?
I should say thankful to the Evercare group in this regard. And the Evercare group has all facilities to deal with all types of emergencies.
All facilities?
Yes, all facilities include any type of road traffic accidents. You can come with very confidence, and it has a state-of-art equipment, and we have 24/7 completely professional healthcare professionals dealing with the sick patients.
So trauma, emergency,
deals with all accident cases.
All accident cases.
Yes.
All right. Well, like I mentioned, this is Smooth Health. If you just joined the show, you haven't missed too much. But yes, you might have missed a bit, though. We've talked about quite a number of things. We've talked about, the role emergency medicine plays, and also the role a general physician plays as well, generally. So, Doctor, I'd like to ask this, though. I know you've seen a lot of situations, right? A lot of situations.
Yes.
But I'd like to understand this. What are the most common ER cases that you see at Evercare Hospital? And could it be peculiar to Lagos State?
Yeah, I can tell you, but the Evercare hospital, we have seen almost all types of emergencies.
Wow.
Pediatrics, gynecological, adult emergencies, medical emergencies, neurological, cardiology patients, road traffic accidents. On my first day itself, I have seen a patient with poisoning who consumed pesticide. He's very young. Yes, he's very young, 26-year-old. On my first day of arrival itself, I've seen the patient in the resuscitation area, and I had to intubate the patient within 1 hour.
Oh wow!
Yeah. So the toxicology and any poison patients. So all these, we have seen all patients. There is nothing like we haven't seen anything.
He consumed it by mistake?
Well, it was intentional consumption, but yeah, it was a suicidal attempt.
Doctor, can we ask, how long have you been in Nigeria?
Well, for me, it is just 1.5 months. And thank you for introducing me to all the population.
Oh, wow. Okay. All right. Look at that.
And as you work, I mean, you've working with Evercare, how has it been here in Lagos for you? You know, the emergencies and working with the team?
Yes. Well, you have mentioned in my introduction itself that I have worked across, and I have 20 years of experience, and I'm working across many countries. I've worked in UK, India, Ireland, and Middle East countries. This is my first experience in African continent.
Oh, wow.
But I'm not finding it any difference wherever I worked in previous places. I'm finding it very good response, and the management of Evercare is very supportive, and we are looking at transforming healthcare in Nigeria, and we are seriously taking it, and there is no compromise in it.
Absolutely.
We got a call coming through.
Right,
let's see who this is. Hello, good afternoon.
Hi, good afternoon.
Good afternoon, sir.
This is Sean.
Hi, Sean. How are you doing
Sean,
today?
how are you doing today, sir?
Thank you.
All right, your line isn't so clear, but go ahead with your question.
Okay. So my question is for the doctor. From his speech, I believe he's Indian. So I would like to find out, because for things like engineering solutions, a lot of the solutions we use here in Nigeria.
Sean, we're struggling to hear what you're saying.
Struggling
Do you
to
mind? Can you
hear
speak
you.
louder?
Okay, hello?
Yes,
Yes.
go on.
Okay. So I said, from the engineering perspective, a lot of the solutions we tend to use in Nigeria, we adapted from the Indians. So for things like emergency response in the medical field, what strategies have they been able to adopt and develop in India that could possibly work for Nigeria?
Can I repeat your question? Can you say it that you're asking me what kind of
emergency response strategies, solutions, and so on and so forth have been
Processes that were developed in India that he can adopt here.
That can be
adopted here
and adopted in Nigeria as a whole, because usually similar solutions tend to work within these two countries, India and Nigeria.
All right, Sean, thank you so much for that.
Sharon, thank you so much for calling.
That's an excellent question, and as I said in previous discussion as well, and yes, solutions and emergencies for the patients is similar in India, similar here, and there are a lot of similarities, as you said rightly, and it is now we are already on the way, and we are dealing every day is the same situations, and we are dealing it every day, and there is no difference between the two countries. And we are adapting each and everything as we do it in both Western side and the Asian side.
Wow.
And we have the professionals from the Western countries and the Asian countries, and there are many of my colleagues also there in Evercare.
So I wanted to ask, right, you just said that you just moved to Nigeria or Africa, the continent of Africa, in the last 2.5 months?
Yeah.
Yes. So that means that in that time, and it's around the period where we're still very much in, COVID-19, the third wave, the pandemic, has this affected ER as well? Has it affected how the emergency situation have been and the cases you've seen come in regards to COVID-19?
You mean the patients
Yes.
with COVID, or
Yes.
any patients due to COVID?
Like when the cases you get, as COVID-19, as the pandemic itself affected the kind of cases that come in? Do you see cases where there's hyperventilation, or like they're coughing, or they're sick, and then it happens to be that they have COVID-19, or that's the kind of case?
Well, COVID-19 cases, the government has certain rules and regulations that if we find out that particular patient has a COVID-19, we have to refer to particular center. But that has not affected anything dealing with any other patients or even COVID-19. And we have an instructions, even if a COVID-19 patient is coming in, we do wear our PPE and we do deal with all life-saving things. And then only we can, when the patient is stable, then only we refer to the isolation center, but not before. But if the patient is stable, if the COVID is confirmed, we'll directly refer to that isolation center. Otherwise, we do deal with all that.
All right.
All right.
Thank you so much, Doctor. Real quick, though, let's move on. Let's talk about subspecialties. Okay, because we know that.
Break very quickly. Sorry, we do have to go for a break. Though.
All right.
Okay.
All right, guys, don't forget, if you just joined us, Smooth Health is the program. And of course, we've got a very special guest in the studio. We're talking all about emergency medicine, the role of emergency medicine, or rather, the role emergency medicine plays in patient care. And of course, our very special doctor is Dr. Srinivas Yamsani. And we're talking all about that. So stay with us. When we get back from the break, we'll do more talking.
This is Smooth Health on the Drive.
It's a global observation that helps raise people's awareness.
Smooth Health is powered by Evercare Hospital, Lekki, transforming healthcare in Nigeria. Smooth Health on the Drive.
It's a global observation that helps raise people's awareness.
Discussing health matters that concern you with relevant information and tips from medical experts for optimal well-being.
How to prevent it, detect or treat it.
Tune in every Thursday at 5:15 p.m. on the Smooth Drive.
So Lagos, if you didn't know, now you know.
This is Smooth Health on the Drive.
It's a global observation that helps raise people's awareness.
Smooth Health is powered by Evercare Hospital, Lekki, transforming healthcare in Nigeria.
Welcome back. You're listening to Smooth, the 98.1 Love Music, Love Life. It is the Smooth Drive. You're welcome to the second half of Smooth Health on the Drive, brought to you by Evercare Hospital. Now remember that you stand a chance to win 10,000 naira voucher courtesy Evercare Hospital. Now that voucher goes to your very first consultation fee at Evercare Hospital. And I'd like to give a shout out to Sheung, our very first caller for today. You have won yourself our very first ticket, our very first voucher for the day. So please send your contact detail, that is your full name, your telephone number, and your email address as well, to 0809-444-0981. Again, 0809-444-0981. We're talking emergency medicine and how and the role it plays in patient care. All right, so if you have any questions for our doctor today, Dr. Yamsani, please go ahead and send us those messages to 0809-444-0981. You can also call us up here in the studio on 01-448-9981.
That's right. Doctor, just before the break, we talked about common ER cases that you see at Evercare Hospital, and you highlighted a few of them for us.
Yes.
Now, Doctor, we would like to know the subspecialties, that work closely with the ER and how they support. Because I imagine that, you can't do all of that by yourself.
Yes.
You have a group of other people.
Yes.
No man is an island.
Yeah.
What are those subspecialties?
Well, see, as an emergency physician, as you rightly said, that we don't do everything, but we do involve with every department. And we do stabilize all the patients in the initial stage. So there are certain patients where we, the emergency physician, he himself treats and can discharge the patient, or where the patient needs to be given to a subspecialty referrals, and we need to involve the super specialist even if required. So we have all that support as of now, in Evercare group, and we have all specialties like pediatrics, neonatology, OPG gynae, and ENT, aphthal, and we have surgery, we have surgical, and neurology, cardiology. So we have all specialists available as of now.
And they're always present when there is an emergency case.
When there is an emergency case, we stabilize the patients, and the time when we need them to intervene into the action, we will inform and we'll get them into the action.
Right.
Yes.
Doctor, I'm very curious to know, do emergency medical doctors perform surgeries? I know today?
Yes, I will say, as I said, we do intervene into, we deal with all specialties. We do the minor surgeries ourselves. For example, there is some wound injuries there. I can stitch myself. I don't have to call a surgeon. So there is small abscesses there, wound care is there. So we don't have to call the surgeons. We do ourselves. But if there is any major surgical intervention is required, so we'll call the surgeon and we'll prepare them. Even if the before surgeon comes, we prepare the operation theater, and the surgeon right now comes in and just operate. All
right, if you've got questions for our guest, feel free to send them in. Once again, 0809-444-0981 is where you can send your messages to. And of course, let me just give you a quick bio of who is having a conversation with. His name is Dr. Srinivas. He's an emergency physician with over 20 years of experience in emergency medicine across many countries, including Oman, the UK, Ireland, and India. And also, he's been involved in teaching emergency medicine for almost 14 years and is currently the HOD and Director of Emergency at Evercare Hospital in Lekki, okay? And additionally, he became an instructor in basic life support and advanced cardiac life support, also which is recognized in America with the American Heart Association and Resuscitation Council of the UK, and also further training as an ATLS instructor in 2015. So just like Judith mentioned, we're talking about emergency medicine and its role in patient care. Now, Doctor, I want to circle back for those that just joined us, that didn't start the show with us. I want to ask this question. The steps that are taken in a typical emergency situation, because we have situations like that every single time, there might be an accident and then people would need to rush someone to the hospital, or maybe, stabilize the person.
A home accident is like the worst, just maybe you're having a toddler around and you're moving about. Exactly. And maybe there's a fire emergency at home, or like an accident at home. We've seen cases of gas explosions, gas explosion from the oven, or the kid playing with a matchbox and lights up themselves in that side of situation. So
definitely things like that definitely happen. So we would like you to walk the layman out there, the regular Nigerians. What types of situations are considered an emergency, and also how can they be responded to? So generally, these are like tips for non-medical, medical professionals.
Yeah, for non-medical professionals, I would like to advise, emergency can happen, as you said, anywhere, in anyone's life, in any neighborhood, when you are walking on the street or at home as well. So when an emergency happens, I would like to advise one thing, that as it is advised by even American Heart Association, BLS as well. So first you have to take care of the scene safety. So you have to see that you are safe. Because you are going to save, just for example, you said a burns patient, right? A toddler is held in a burns. So you have to make sure that the scene safety, and you're not going to injure yourself. And immediately then you have to try to attend the victim. So in that case, you have to first call for help as well. And you can call the helpline number of emergency as well. So you can call for help, and first thing you need to check is whether the patient is unconscious or not unconscious. And I would like to suggest for everyone to have the skill is how to recognize a patient unconscious.
Okay.
How to help the unconscious patients, how to check the pulse, and when to start the cardiac pulmonary resuscitation, how to start chest compressions. Soon we are planning, and hope it will come up very soon. And we are going to conduct even some community events as well to make the awareness about these kind of situations, how the layman should react if any emergency happens in front of you.
That's very wonderful. We have messages here. This is Bola, and he goes, "Hi guys, kudos to the MD. Emergency medicine requires a lot of adrenaline pumping to stay on top of things, can the MD touch on some health teachings like basic resuscitations and first aids to be carried out prior to reaching the ER, especially in a traffic jam in Lagos? I think the doctor just talked in that.
Yes, I just now mentioned about it. And even we have a trained paramedics, I would like to mention. We have a trained paramedics and we have 4 ambulances supporting us with emergency care. And they are very professional paramedics, and they are trained with all life-saving drugs, and the ambulances do contain all life-saving medication, and no difference whether you are in emergency or an ambulance. While you are moving to Evercare or you are moving out of Evercare, your treatment continues.
Right. Yeah. We got a message from Ehi from Yaba. Ehi says, I want to ask if you have an optometrist in Evercare. I imagine that you do.
Yes, I do.
As everything is at Evercare.
Yes.
Guys, everything literally is at Evercare.
Yes.
This is Ijoma Basi, and she goes, would Red Cross training help with dealing with domestic emergencies? With the Red Cross training, I'm guessing she must have gone through Red Cross training. Some type of training from the Red Cross. And she's asking if this training can come in handy when dealing with domestic emergencies.
I think domestic emergencies training in Red Cross, I'm not very aware of it, but I think what she mentioned is about first aid things. The first aid things, definitely we can do that.
Yeah.
Yes.
All right. So if you have first aid training from Red Cross, that can come in handy in like domestic, for example, wounds or anything else.
Yes.
But if something that needs immediate attention, like stitching, you pretty much make sure to call and run to the ER as much as possible. Yeah, so you can join the conversation as well. Send your messages to 0809-444-0981. Again, 0809-444-0981. Our doctor here in the studio is Dr. Yamsani. He is a ER medicine doctor.
Doctor's chuckling here.
I'm so sorry, sir. Yamsani.
No,
Right.
Yeah, I got it. Dr. Yamsani. And he is an emergency physician with over 20 years experience in emergency medicine across different countries, both Asia, the Arabs, and of course in the UK and Ireland as well. And we're talking about a medical emergency and the role that it plays when it comes to patient care. All right. So, doctor, before we let you go, because we're almost out of time, what is one medical skill that you recommend everyone to learn to save lives?
Well, I want to learn everyone is basic life support. Basic life support involves how to, as I said previously mentioned, like how to recognize unconscious patient is live or dead. That is one thing.
How to recognize if a patient is unconscious or alive.
If the patient is unconscious, one thing is you have to just tap and see whether he is unconscious, he's answering your questions or not.
Okay.
And the second thing, you have to see whether his chest rise is there, whether that is a sign of a breathing.
Okay, but if
it is not there, then you have to immediately check the pulse, whether if the patient has a pulse. If that is not there, then you have to start chest compressions.
And how about for the regular layman out there, how about the mouth to mouth? How does that work?
Well, mouth to mouth. Yes, that this question was there even before with American Heart Association before 2015 guidelines.
Okay.
In 2015 guidelines, they have advised a pocket mask.
Okay, so wear a mask.
Yes.
Because of course this is
give the breathing to the patient. But if you think that the patient, or if your family member, or for example, you know that that patient has no contamination, then you can confident you can give mouth to mouth. But even if you are not confident and you cannot give breathing, but don't stop giving chest compressions.
Chest compressions.
Chest compressions is very important because that is called cardiopulmonary resuscitation, and that is a part of BLS. So that helps the patient until you get advanced help to your place.
That's really wonderful. If you're just joining us, oh my goodness, where have you been? It's been such an insightful show today. Dr. Yamsani is here with us, and we're talking about, just emergency medicine and the role that it plays in patient care. And that's pretty much our show today. But doctor.
Yes, doctor, just before we step out of the studio, though, we would like to know, the good people in Lagos would like to know how they can reach out to you and also the doctors at Evercare Hospital.
So it is important that the hospital location is Lekki, Lagos, 1 Admiralty Way, Bisola, Durosimini, Eki Drive.
Yes.
Eki Drive, Lekki.
Okay, for someone who's been in Lagos
for just 2 months, he's done really well.
Yes, but I was every day drive in and drive out by the drivers.
Okay.
And then the maps, of course, was always yelling, and you're turning into Bisola Durasimi Eti Drive. So I'm sure you know the name, but keep going, sir.
But what's the website, though? How can they reach out to you?
Website is www.evercare.ng. And telephone number you can reach out by 08139850710, and you can email us at info@evercare.ng.
All right. Thank you so much,
Beautiful.
Doctor.
Thank you so much, Doctor, for
Let's
that.
reiterate this again one more time, shall we?
Yes. The location is number 1 Admiralty Way, Bisola Durosimi Eti Drive, Lekki Phase 1. That's number 1 Admiralty Way, Bisola Durosimi Eti Drive. The website is www.evercare.ng. You can also call them on 0813 985 0710. That's 0813 985 0710. You can also email them. It's info@evercare.ng. Again, info@evercare.ng.
All right. Thank you so much, Doctor. A pleasure having you here, and we definitely look forward to seeing you again.
Thank you so much, and I wish all the people to stay safe and be well, be healthy.
Be healthy. Very important.
All right, Lagos, there's more to come. This is the Smooth Health Show. By the way, Sharon, you are our first caller, so you have won yourself a voucher as well. Also, for those of you that sent in messages, Ijeoma Basi Ehi, Jay from Toronto, we're going to reach out to you on how you can claim your vouchers. And also, don't forget that these vouchers are for your first consultation at Evercare Hospital.
Absolutely. So make sure to send your details. All right, please send them to Sharon. Please send it to 0809 444 098. We're waiting for you to send it. Again, 0809 444 0981. That brings us to the very end of Smooth Health on the Drive. Doctor, thank you again.
Thank you. Thanks again.
Thank you.
Smooth Health on the Drive.
It's a global observation that helps raise people's awareness.
Every Thursday at 5:15 p.m.
If you didn't know, now you know.
Powered by Evercare Hospital, Lekki. Transforming healthcare in Nigeria.
5, 4, 3, 2, 1.
Yo, mic check.
Get the tea on today's trending stories on the top 5 at 5.
Let's get it going.
Everything from hot gossips to breaking trends, information, and more. So much to talk about.
Ladies and gentlemen.
Yes, so little time.
Rewind, say it again.
Catch the top 5 at 5 on the Smooth Drive every weekday from 5 p.m. Only on 98.1. 98.1.